Good afternoon. I'm Rebecca Jones-Gaston, she, her. I am the Child Welfare Director at Oregon's Department of Human Services, and it is my absolute pleasure to be here today. We have a lot of information to cover. And before we dive in, I want to take a couple of moments to just let you know what is in store for today. We are going to talk a little bit about some of the legislative highlights and talk about our vision for transformation and introduce you to the Child Welfare Executive Leadership Team. So I want to start by introducing the Child Welfare Vision for Transformation. I'm hoping that many of you have seen it, that you've heard about it, but nonetheless, we're going to talk a little bit about it today, about how it came to be, how we are using it, and give some examples about how it's actually being brought to action. We decided that we absolutely had to have a roadmap of where we wanted to go that really was embodied by the values and the principles of what we believe we want to have our relationship be and our work be for children and families here in Oregon. And we talked to many of you. We talked to our partners, to parents, to young people, to our workforce and our provider community to give us input on what do we envision for the work of child welfare, and came up with these core principles and values that we pulled together. And of course, we put some color in there, made it a pretty document, but really it is intended to be our roadmap, our guiding star, our touchstone, whatever analogy you want to use, really just to help us as we're making decisions about child welfare here in Oregon and using it to create some common language as we do this work together. We really are wanting to have our work and involvement in the Child Welfare Agency really focus on preservation and prevention, and build our capacity to be able to help children stay connected to their parents, to their families, to their communities. And when that's not possible, we want our foster care intervention to be the best it possibly can be, where we're teaming with our resource families, with our providers and our partners to really support a child's healing and connections to their family, ultimately to try and reunify children with their families. But when that isn't possible, being able to actually help them get through our child welfare system as quickly as possible and achieve permanency into a family and have stability. And so we're going to talk a little bit about the three core principles and give you examples about this. But I really just want to highlight that our intention is that this is a living document. It's going to evolve as we grow and develop and evolve. And we're going to learn things along the way together that maybe we didn't know when this was crafted, and we want to make sure it gets included. Or we're going to realize that there's some other pathways that we need to add to our journey to transformation. And so, before I turn it over to the team to walk through the principles, I do want to just highlight some of the key legislative investments, budgetarily and through statute, that really are further investments into the vision for transformation and the direction that we want to go. And I'm not going to get into nitty-gritty detail, but we can absolutely answer questions and provide additional information during this session or afterwards as needed. So a few examples of the investments that child welfare received through the legislative process includes the ability, we have resources now to be able to build our family preservation program and really think about what are the prevention services that we want as child welfare to be able to have available for families. And prevention, when I say prevention, It's prevention of placement into foster care, but really more importantly, it's prevention of maltreatment. And really trying to mitigate some of the challenges that families come to us with, and really have our involvement be a light touch. We had investment in our training and workforce development, in the work that we're doing with older youth and young adults, and our independent living services, in the Oregon Indian Child Welfare Act, which is really critical to our commitment to equity and really honoring the relationship and importance of helping children from tribal communities, tribal nations, maintain their connection and relationship with their tribes. There were wage rate investments for the provider staff, in addition to additional services for children that are in foster care. And so we're excited about the opportunity from these investments that will really just support our continuing to put this vision for transformation into action. So I want to just thank you for joining us this afternoon. We are all very busy, and I know that you are also, but thank you for taking time out of your busy schedules to listen in on what we have to share, but also for the thoughtful questions that you all sent in advance. And so we're going to walk through the 3 principles from the vision and some examples, and then we're going to get to answering some of the questions that many of you sent in advance. And as I said earlier, if you have additional questions, please put them in the chat. We're going to get to as many as we can during this time, and are committed to providing answers, even if we run out of time, in some other format. So I'm going to turn it over to Lacey Andreessen to start us off with guiding principle 1.
Thanks, Rebecca. Good afternoon, everyone. My name is Lacey Andreessen. My pronouns are she, her, and I'm the ODHS Child Welfare Deputy Director, overseeing program and practice. You can see here on the screen the language of guiding principle 1 that really outlines how, in the least intrusive way, we interact with families experiencing our system from a very strong value base. And I'd like to talk with you today about one effort that we're working on this year that really personifies this principle. We're building a family preservation system, and that build needs to happen both internally within our child welfare agency, but also externally with all of you as well. Because to truly move into family preservation, it's going to take the partnership of not just child welfare, but all of the agencies across our system and partners across our system who help in serving the population that we serve. So internally, in thinking about family preservation, we're working to build the infrastructure so that we have caseworkers, units, supervisors on the ground in the branches across the state who have the skill set to work with families while we're managing safety and serving their children at home with their parents. We've created a governance, and I see names here with us today of folks who are already participating in this work that invites a lot of people to the table alongside child welfare, providers who serve families prior to their child welfare experience, stakeholders who work with us while families are experiencing child welfare, and also the voices of lived experience from resource parents, parents who've experienced the system, and children and young adults who experience the system as well. We have identified our 3 sites where we'll begin implementation of family preservation units. And we also are grateful, as Rebecca mentioned, that the legislature has made an investment so that we programmatically can have a family preservation program within central office to partner and oversee this work. I think one of the things I'm most excited about is the way that we are taking an opportunity to partner with self-sufficiency program within ODHS in a very intentional and clear way to start modeling internally what we're really asking you all to join us in externally as well. And I can't say enough how important I think it is that you all understand where we're headed in family preservation and really agree to join in with us. This isn't something that we can or ever would want to do alone. We really want to be thinking with our community partners about how to get the right calls to the hotline, for example, or where else concerned family should go if there's other concerns between child abuse or besides child abuse or neglect. What we know is still about 40% of the calls that go to our hotline are not allegations of abuse or neglect. What they likely are worries, concerns, questions. So we want to be thinking through, how do we strategize for the mandatory reporters and interested parties in the state so that they know where to go to get the right intervention for the family that they're calling or concerning about. Another effort in this area of becoming family preservation was the intentional terminology change from foster to resource. Foster parent to resource parent. We really want parents who have to serve children, who get to serve alongside us when a child has to be separated for the purpose of foster care, that family caring for them carries the value of being a resource to that child and their parents that they're serving, to provide wraparound supports and really work collectively and together toward really timely and safe reunification as being our first goal when kids do have to be separated. I'll hand it to April to talk about Principle 2.
Thank you, Lacey. Good afternoon, everyone. April Flint-Gerner, she, her pronouns. I'm Deputy Director over Equity Training and Workforce Development. And so I'm going to talk just a minute or two about Guiding Principle 2, which is about enhancing our staff and our infrastructure. And so we're really, really excited about a few things that I'll highlight today. We're preparing to launch planning for a statewide coaching model with support from the Federal Children's Bureau Technical Assistance Team. And really the goal of our coaching program is going to be to increase the psychological safety of our workplace, provide support for staff that really model the kind of engagement that we want them to have with families, and to create a learning culture. What we know is that the support that our workforce really needs around good quality supervision and a soft landing when they need to really learn along their journey is what's going to help us to retain a good staff. And we're really excited about our partnership with Portland State University School of Social Work and our training partnership growing. We are looking at possible ways to expand our child welfare education program to target even more staff receiving financial support to advance their education, particularly those staff that live in rural communities, our tribal communities, and our underrepresented staff, and those staff who really are interested in getting bachelor's degrees and bachelor's of social work. So we're excited about that. We also are looking at the expansion of our central office equity training and workforce development team. Previously a training unit, we really have grown over this past year and a half and are excited about the growth that is continuing. The newest additions to our team have been the equity team that are specifically focused on the development of strategic plans around policy and training and capacity building for staff, community and tribal engagement, and so much more. And so one example of something that they're working on right now is the implementation of a social justice and equity tool that we are currently using to look at all policy changes through the lens of equity. And so with the legislature's support for the equity training and workforce development team, and those additional positions, we're really going to be able to expand the functions of our team to support more transfer of learning, more coaching, and professional development, leadership development across the state for all of our staff. And the last thing I'll talk about briefly is that we're working towards the development of a robust community engagement framework. And so, this is why we really want to be able to talk to you all about it. We've never made explicit what we mean by equity and sharing power with communities. And we really want to make that explicit with every level of our staff. We need to be in partnership with the communities that we're serving and creating and maintaining meaningful partnerships at every level, to make sure that those with lived experience, those that have the cultural wisdom of how to serve our children and our communities, that they are at the table with us in the planning and the delivery and the implementation, and particularly for those communities where they are overrepresented in our system. We really want to make sure that we have diverse representation within our workforce, within our advisory structures and committees, and in our implementation efforts and our practice improvement efforts. So we're really excited this year as we build out the equity training and workforce development, grow out our partnerships, and really commit to sharing power with you as community members. With that, I'm going to turn it over to Alicia to talk about guiding principle number 3.
Thank you, April. Hello, I'm Alicia Cox, Deputy Chief of Strategy and Innovation, she, her pronouns. And for guiding principle number 3, where it talks about the data and the utilization of data so that we're informing our decisions on our practice, but really using the methodologies of continuous quality improvement is really close to home and important to me. So I am always so invigorated by the work that happens in child welfare because we do have a lot of data. But what are we doing with the data to inform our decisions, to change our practice, and then using that in a sustainable way so that not only are we changing practice, but long-term we're also utilizing it. It's not just a patch to get us through to the next data point. And the one thing that I appreciate about the work group that we're having at the statewide system is getting the feedback and perspectives and diverse experiences around the table as we're building out this continuous quality improvement structure, so that we're acknowledging and recognizing that there is some data inequities that we need to address, and having the accessibility to the data, and also coming to these forums and other forums to talk about our data in a way that's understandable, digestible, and also receiving feedback and perhaps even some ideas about some strategies. And with the legislative support of our POP, which is a policy option package for team of CQI experts, we're hoping to really build out this foundational structure statewide. So it isn't just a cap on to somebody else's additional work. We're incorporating it as part of our everyday, so it doesn't feel like a heavy lift. But in order to do that, we have to do some capacity building and understanding of data and data literacy. Of course, these strategies for improvement, we're here to build out relationships with our community partners, people with lived experience, so that we have that perspective as we're looking at these strategies and being targeted in our movements within those metrics. And as part of that process, it's really encouraging people to speak up and speak out so that we can incorporate that as we go forward into our data philosophy and vision. And we don't have Tim Gillette, who is our Chief of Operations. He is really the bridge between child welfare and self-sufficiency programs. He joined the team just recently, and we know that the work that happens in child welfare and self-sufficiency, goodness, I am just stumbling all over. Self-sufficiency programs really are interwoven and integrated. So to be best utilizers of the funds that we do have and the resources that we have, it's really necessary to build out those bridges, and that will become apparent in our family preservation work. And I'll pass it over to Rebecca.
All right, so that is very quickly our child welfare vision. We're going to be talking through some of the questions that were sent in advance, and along with that, give some additional examples that I'm hoping you'll hear resonate and be connected to the guiding principles that we just quickly went through. But I also want to really just set some additional framework. Is, you know, we've talked about this vision for transformation and what we want our role to be with children and families. And that sometimes, you know, maybe doesn't sound new. And people are like, yeah, that's what you've been doing. And so it isn't brand new. But what I think is a little different is that we talk about our work as part of a larger child well-being system. And so, you know, all of us on this call, I know, and all of us that are serving children and families in a variety of different ways, we ultimately want children to be okay. And that means that we need to be really focused on how do we help maltreatment not happen, so that the child welfare agency doesn't need to be involved with families at all. And that's a little bit of a shift from where I think we in child welfare have even historically been focused, is how are we partnering with community organizations? How are we partnering with communities and families and young people to help us inform what we're doing, but also be a support and a good partner for those systems and agencies and organizations that are touching families and children long before there's a concern that makes someone pick up a phone and call the hotline. And so we are absolutely committed to doing our part in a child well-being system as best as we can, and to grow and transform towards that. But we can't do it alone. In the space of the commitment to wanting our communities to be healthy and well. That means our families are healthy and well. That means our children are healthy and well, with us all working together. And so I wanted to just highlight that in the context, as you'll hear us talk about in answering some of these questions, but that really is the lens that we are coming to this work, to our partnership with you, is how can we strengthen, improve, transform our child welfare agency and work? And then how are we partners with everyone that's actually serving children and families, again, long before the child welfare agency gets involved. And that doesn't mean that we're not valuing the folks that are on our workforce, the folks that are alongside us and helping care for children and families at these times of crisis and challenge. We absolutely do. We just want to also think about how do we minimize and really impact not having children and families experience the trauma that comes with being involved with our child welfare agency. And so we're going to get to questions. Many of you sent in some questions, and so we've tried to synthesize them so there are themes that you will hear in our responses. And then hoping that there's time to be able to respond to the questions that you're sending in chat along the way. And again, at the end, give you some instructions about what information will be coming your way following this conversation. So I'm actually going to hand it back over to Lacey to answer our first question.
Thanks, Rebecca. Lacey here again. We got some questions really about what ODHS Child Welfare is doing to build trust with families, communities, and stakeholders. And I'd like to answer this from a couple of different angles about how we're working specifically on that. You heard me talk about Principle 1, moving our practice to a value base around how we engage with parents and families, understanding who people are and what they bring and what's happened to them, and meeting families where they're at to really hopefully have their experience of child welfare be something that feels less traumatic and less invasive. Another effort that we're leading is working with each branch across the state has a program manager, each district has a district manager. And we spent some time thinking about how that team comes together and how we work with them. And so we've been doing some deliberate work with our branch and district leadership about getting some consistency in practice and service delivery, doing a lot of coming together, similar sizes, doing lessons learned around good practice, planning together around some efforts that we're trying to move statewide. Another thing that's happening in practice is the increased utilization of well-facilitated family meetings. And why I connect that to trust is that when everyone involved in the family, most importantly, including the family, come together on a regular basis and plan, what we see is that cases move more quickly. Everyone, resource parents, children, service providers understand what's happening in a case plan in a way that makes the movement through the child welfare system a lot more transparent and honest. So that's a practice that we're continuing to strengthen and move across the state. For those of you who advocate for families involved in the child welfare system, for those of you who serve alongside us with parents who are separated for the purpose of foster care, I would encourage you to know the leadership structure in each of your counties and districts, get to know who they are, and never be afraid to raise up your concern if you believe that what's happening at a local level with a worker or a supervisor isn't the best case scenario for that family. We have those structures in place for a reason. And I always want to encourage folks to be sure to include others when there's concerns about decisions that are being made, confusion about the direction of a case plan. That's their roles, and we entrust them to lead your counties and your districts. So please know who they are. And then the last point that I would raise about this specific set of questions that we got is that we're really working toward being accessible to community in very real and tangible ways. This is our first try at a statewide conversation with partners. We're also doing this locally. And anytime, if you would like for us to come and talk with your teams, we're happy to do that so that you understand who we are and what our vision is for our agency. And that then you should be able to see that aligned in the work that happens on the ground. And really expanding our tables where we have advisories, making them true advisories to child welfare executive leadership and participants right alongside us and rolling up our sleeves and doing the work. There's 3 examples I would give of advisories. And again, I see some of those faces today. Our Child Welfare Advisory Council, our Parent Advisory Council, and our Youth Advisory Council, really looking at who's there, who are we missing, and how do we get the right people in those conversations so that we're getting the reflections and representations and input of all of the important stakeholders within our child welfare system. I think the next question is, Alicia has something to add on this one.
Yes, thank you. And I think just going along the same lines that Lacey talked about in terms of accessibility, it's being transparent about our data in a way so that we are coming to the table and sharing the different strategies that we're using and being open and transparent about our current state and knowing that we're here to improve. So having that opportunity to share with all of you as we go forward, thinking about which ways and how we can continue to engage with all of you in that respect in terms of data and data sharing.
And I believe the next question is with me. This is April. And the question is, what systems do you have set up for families who are experiencing bias-related harm from their caseworkers? And specifically, it was asking about racial, LGBTQIA+ and disability bias, and how would a community partner refer someone to receive support around this? So we're really working hard to create a culture where equity really is our North Star, and our vision for transformation makes that really clear. We want to create value for, the intersectional identities of the communities that we're serving and the people that we're working alongside, and really understand what we gain by respecting the diversity of the communities that we're serving and those with lived experience. And so these conversations have been happening literally every day, all day. We're trying to build the capacity of our leaders around our state to understand how our system impacts communities and how hard it is to serve people when we don't treat them with genuineness, empathy, and respect, and ultimately the dignity that we're all deserving of. Bottom line, unchecked bias, although we all have biases as human beings, it's not okay, and we're working on it. And so what we're asking staff to do is to humble themselves, be willing to admit when they get it wrong and do better. We're asking people to grow their cultural humility, be committed to lifelong learning, institutional accountability, and sharing power. And, to answer specifically the question, discrimination is never okay. And so if people are experiencing harm related to bias, we really want to encourage anyone that we work with or on behalf of to feel comfortable and safe in bringing it up to us when they're experiencing those effects, and know that we are going to do something about it. And so there are a couple of different ways that we can get that done. So first, any community partner, any family member that we're serving that is experiencing anything like that should absolutely reach out to the supervisor of the caseworker at the branch or local level. And if that is not successful, reaching out to the program manager, the district manager, that local leadership absolutely has the capacity and the heart to really respond to our community around these kinds of challenges. We also have a governor's advocacy office that executive leadership team is meeting with regularly, where we're hearing about these kinds of things. And then we turn around and use that information to help improve our system, to know the kinds of conversations that we need to have with our leaders and with our staff. And last but not least, I'll just mention, you have gone through those steps, reaching out to local leadership, our governor's advocacy office. You can also reach out to us directly at the Child Welfare Director's Office at dhsoha.state.or.us, and we'll make sure that you all have that email address should you need it. So I believe I'm turning it back over to Lacey for our next question.
You'd think after 18 months I'd have the unmute button down, but no, sometimes it's still an issue. So there's two questions that are here that are for me. And I just want to note, some of you are sending me direct messages that are really great questions and thoughts. I might not have time to respond to them right now. I'm going to capture them and we'll get back to you. I think that some of the other team members are getting those too. So I see you and we will respond, just so you know. Two questions around service delivery. The first one is, what changes are being made to support families with children with complex and diverse needs? So this is a continual work in progress for us. I'd like to speak to a couple of efforts that are happening right now. We're working to expand capacity with providers in all of the child welfare serving systems, in OHA, in the Office of Developmental Disabilities, to really have what's needed for a child or a young adult at the time that they need it. We're doing some really good data tracking to help us identify where we may have gaps, and then really partnering across systems to be certain that we can get a child or young adult the level of care or service that they need. We also have within our team, it's still relatively new, 26 contracted nurses throughout the state that visit children at the time of removal and then again at reunification to do that first assessment of a child and their needs. They also follow medically fragile children and young adults throughout their time with us and provide individualized support to the resource parents that are serving those children. And then the third thing I'd say is we're working with specific designations, one within OHA, one within the Office of Developmental Disabilities, to partner better with those systems, to advocate correctly with CCOs and local CDDPs, so that we're really becoming a child welfare serving system or a child serving system and not a whole variety of separate silos. Next question, similar but different. How are we supporting older youth and young adults that are in or have aged out of foster care? Lots of energy and design going into serving this population and serving them well. We've designed and implemented some supervised supported independent living opportunities. Currently, there's 5 locations across Oregon that have these housing supports. They're individual apartment unit settings, and they're specifically for young adults who are still in our care and custody, who have complex needs. And it really is creating a whole person care system where youth begin to get the real life skills, like have a rental history and have co-located mental health supports and psychiatric supports that can help them be safe and stable. We've also included the young adult age 18 to 20 in the population who will be eligible for behavioral health treatment foster care. They have to be willing and interested, but they're definitely going to be included in that population as it's appropriate for them. And they'll be eligible for specialized service contracts, including skills training, mentoring, and equine assisted therapy. We had a good investment this session from the legislature that gives us an expansion on a dollar array that can be really specific and child driven around what they need for services. Specifically in response to COVID, we've done a lot to expand what's available for children and young adults who've experienced foster care and then have the additional complex needs that come from living through a pandemic. I'm going to give you the highlights, But at the end of our time together, you're going to receive an email from communications, and there will be 2 attachments on them that outline all of the COVID-specific supports, our ILP supports across the board, and then all of the information about who's eligible and what the criteria looks like. Some examples, we've expanded all of our ILP services to serve up to 20 children to the age of 23. And we also got federal dollars that can be distributed specifically to children and young adults, eligibility between the age of 14 and 26. We've been able to increase the amount and the number of educational training vouchers and changed some of the eligibility requirements around that. So even if a young person had to leave higher education last year because of COVID, they're still eligible back this year to get those. And then we also have increased transitional living programs for current youth in care and for young adults who experience care. Last thing I'll say is that across the board, we're really working on growing up and developing our workforce skill set around serving the needs of older youth, including how important it is to be continuing to plan for permanency amongst sometimes what can be a lot of crisis around placement or struggles with pain-based behavior, that we keep this North Star, that connection, attachment, well-being, belonging is our ultimate goal for kids and young adults. And via a really robust workforce development plan with large trainings, learning circles, and then case-specific consultations, my hope and belief is that this work is really going to move us towards better outcomes for children and young adults. Oh, last one for me.
Yeah, I was going to say, Lacey, I'm going to jump in and provide some a response so that you can take a breath. She's got a number of questions that are targeted for her to answer. I really just wanted to chime in and add on to some of what Lacey and April and Alicia have already shared around ways in which we're really trying to have equity be at the forefront and the driver for everything that we're doing, and talk about the fact that our expectation is as we move into contracting relationships, that we are really building in an expectation around equity, and not just equity in its name, but what does it look like in behavior and outcome that we really want to see represented. And that's the same thing with our workforce, wanting to absolutely be having expectations in position descriptions that we are really expecting our workforce to be having equity at the forefront in how we interact with each other, how we interact with our communities, how we're serving children and families. And across Oregon Department of Human Services, we really are collectively having this conversation. So it's not just child welfare kind of off running on its own path, but we really are looking across the department for how are we all collectively making this transformation to equity, but also how are we really working with each other across our own divisions within the department to really serve the people that we collectively serve anyways. And so how are we better coordinated in helping with the navigation of our systems to relieve some of the pressure to figure it out if you're a family or a young person trying to navigate our systems. And then really building in our ability for prevention. And I can't emphasize that enough. Because ultimately we want prevention of maltreatment. And so we created in this last year a specific team that's focused on fatality prevention and working with our partners around suicide prevention and safe sleep practices, and really looking at what are the circumstances related to when the tragic death of a child occurs, and what is it that we across systems can do to try and reduce and ultimately eliminate preventable fatalities. And then when substance use is a challenge across the country and certainly here in Oregon, and that plays a role in parenting and safety and protections for children. And we absolutely have to be working collectively in helping support people in recovery and addressing addiction, but also really how to possibly learn new skills, knit together all of the system supports that are available to support families and young people that might be struggling with substance use. And so I just thanks Lacey for letting me step in. I really just wanted to kind of add those additional kind of threads across all of the things that we're sharing today. So back to you.
Thanks, Rebecca. Next question from me, this is Lacey, is around what are our efforts around retention and recruitment of resource families? The question came from a specific area, but I think it probably applies across the state. So my thoughts about that, we have been given 16 positions whose primary focus is retention and recruitment of resource families. They have developed recruitment plans by district that are based on the population of families that we serve, so race and ethnicity, cultural needs, developmental needs, and driven by where they have gaps in their current resource family array for children and young adults in their districts. They also partnered with that district leadership team to create the retention plan. Because if you've worked with our agency for any period of time, you know that having someone come forward to be a resource family is one thing. Having them agree to continue doing it after they've interacted with our agency is a whole nother ball of wax. So it really is a combination of both that champion and then all of the staff in that district agreeing together what actions they're going to take to retain families. We're also working with the Office of Developmental Disabilities, some of our BRS providers, about how can we join forces in finding families in Oregon who can serve Oregon's children and being less siloed around who certifies them. So I think that's a really important effort as well. And then lastly, I would say each and every one of you on this call can join with us in being champions for finding resource families for the children and young adults that we serve. It's so important that we have the right family to serve the right person who needs it at the right time. And you all can partner with us. We welcome the help and the effort for that.
Lacey, I'm actually going to jump in this time as well, because I think the intersection between the equity work that we're trying to do and the efforts around serving our resource families, we've just had such kind of robust attendance and engagement with our KEEP partners who during the pandemic had all of their support groups went virtual. And so that meant that folks who maybe didn't have access before could attend those support groups. And now we've got all of these affinity groups that are being met, needs who are being met by our KEEP support groups. So those that are serving our young adults of color, our children of color, our children with disabilities. And so really we are looking to create within the training and workforce development team, the equity training and workforce development team, we see our resource parents as part of our workforce. And so they should get the kinds of follow-up supports and coaching and mentoring and all of the things that they absolutely deserve to feel supported in their role. So we really appreciate partners like KEEP who help to provide those spaces. And we also, are looking at, we are really doing a complete overhaul of our training. We've got all kinds of folks on my team right now who are building their capacity on curriculum development specifically for our resource parents. And we really are embedding that equity lens throughout all of these conversations and really trying to push for affirming placements, really making sure that there's a sense of belongingness for every child in our system, that they have to be in out-of-home care. And so really, really excited about all of those things that are coming. The next question actually is for me, and it is about workforce. And so this is April. The question is, how are we reducing caseworker turnover? What is being done to make sure that new caseworkers receive proper training and support? I am so glad that somebody asked this question. So our entire philosophy around guiding principle 2 is in response to that question around really focusing on a full workforce development framework. And so what has been the trend in child welfare and many human services is that we tend to train as the only strategy that we use around system change. And what we know about adult learners is that we really only retain about 10% of what we learn in a classroom training without priming the brain for learning and then following it up with reinforcement and practice. And so I can go to a training on how to be a really, really good basketball player like Kobe Bryant, but I guarantee you I will not get there unless I do a lot of practice, and then I still probably won't get there. But we really want to make sure that we are really focusing on the fullness of what an adult learner needs within our workforce, for example. Also, we are doing things like we have this whole robust network of that we're building around critical incident stress management and debriefings. So we've been offering, and the acronym for that is CISM. We've been offering CISM support throughout the global pandemic, and staff are really responding well to them. So when we have a critical incident, staff are provided a space to kind of reflect and debrief, and we are looking at growing that program. We have not necessarily out of central office focused on workforce well-being, so we're really excited to have staff that are focused on workforce well-being on my team within workforce development, and really thinking about how do we address burnout, compassion fatigue, secondary trauma, and then some. And then the last thing I'll share is that we've been really working with human resources and our program managers most recently to give them some additional tools to retain staff. Coincidentally, just this week, we are spending 2 days with all of our program managers to build their capacity in workforce retention and recruitment best practices. We had a wonderful conversation with them today about why they're still here. And it was so inspiring to hear about why all of these leaders are still here serving in Oregon, serving in child welfare. And many of those program managers are planning to go right back to their staff and ask those very questions. And so I think sometimes when we talk about retention in our workforce, we're always asking about why people left. And we really want to think about why are people staying, and really that same thing that we do with families where we want to build on strengths. We want to really build on our strengths, not acknowledge that we don't have areas for growth, but want to build on those strengths. And so when I talked about the coaching program and those kinds of things, we want to move beyond just training to asking ourselves what staff need to feel empowered, confident in their practice, and supported inside and outside of that training room, mostly when staff feel that they are making a difference, when they have quality supervision and coaching, and when they have a clear mission in thriving organizational culture, research says that they will stay. And so those are the things that we're working on. I'm going to turn it over to Rebecca.
Thanks, April. And so we're coming close to the end of our time together, but there are a couple additional kind of questions and things that we want to make sure that we highlight. I would be remiss if I didn't acknowledge of what a strange year this past year has been. I came to Oregon a little over a year and a half ago, and we would be doing these things in person, a year ago. And it really has been an unusual circumstance for all of us. And it has absolutely highlighted for our communities that were vulnerable and struggling before a global pandemic, just how much more that has impacted the communities that we serve and ourselves and each other. We had to quickly make some change to how we did our work. ODHS stayed open. Our offices did not close. We certainly had a reduction in the amount of in-person time together in our offices, but we still had an obligation and requirement that we had to be serving the communities that we serve. And so with that, there are some things that we did around modifying our practice, and some of the things that we're hoping to be able to continue because we've learned some really important lessons. One of the things I want to highlight is, and I mentioned it earlier, is the development of this vision for transformation actually happened in the face of the pandemic. We went from having, listening in-person meetings and gleaning that information early on to really thinking about, we've got to engage with all of you more frequently. So we changed many of our quarterly meetings to monthly meetings, and some of them were actually weekly for a while. And we've created some pathways to be able to have lots of different input from different experiences, helping inform the decisions that we need to make. So how do we make decisions about in-person parent time with children in the face of concerns around safety? And I know Lacey can speak to this a little bit shortly, but I wanted to call out that for me this year has been, it's been hard, and it's been hard for all of us, but I've been really energized and excited by the kind of engagement that we've been able to have with partners and with community. Our Parent Advisory Council, our Oregon Foster Youth Connection, our provider community, everyone has been showing up and rolling up sleeves and saying, okay, how do we do this? And let's move forward. And really embracing something that I said early on, and I know has been said in other places, is we can't go back to normal, because normal wasn't working for our families and communities that we are serving. We absolutely have lots of opportunity to be thinking about what's our forward. What do we want to hold on to and continue to build? And what are the things that we actually have the opportunity to change and do differently? And we've learned a lot about virtual space. I will be so excited to get a sense of how tall people are when I when I get to meet you in person. And not see a little square on a screen, but it is actually in some ways afforded our ability to be connected more frequently in ways that we didn't necessarily have in place prior to the pandemic. And I'm going to actually ask Lacey to share some of the specific things that we did around practice and the service that we were doing related to our COVID response.
Thanks, Rebecca. We did get to continue in the places within a caseworker's role that there's assessment of safety. That continued in person. So some initial contact at a safety assessment, things like reunifying children with their parents, children having to move between placements, and things like certifiers doing walkthroughs as they look to certify homes. Some of that work continued all the way through the pandemic. That is just the importance of child safety assessment. Just there are some things that you've got to put your eyes on and be there in person to see. What we did start doing almost all of virtually at the beginning was interactions with parents, face-to-face contact with children, some family meetings. And I think one of the things we'll take out of this moving forward is we probably spent too much time driving and not enough time interacting with people. And there's a lot of value add you can still get from this interaction. And what we heard from parents was sometimes when you're having a really hard conversation, it's a little easier to have a little bit of space. This is actually trauma informed for some people as they're working through really having, really, really fierce, hard conversations. We also early on, when we did stop most parent-child visits in person for a couple of months, we heard from parents they were seeing their children virtually more than they had been seeing them in person prior to what used to be a pretty standard once a week, 1 hour visit kind of setup for families. And so for a huge lesson moving forward is alongside the times when we need to see people in person, how much more value add is there to be able to do things virtually? And also that we start, if a child must be separated from their parent for the purpose of foster care, what's the most contact we can provide for them, including virtually? Moving forward, as we plan for our office spaces, as we plan for how caseworkers schedule their day, we will be incorporating a lot more remote work than what we did historically, but also thinking about strategies for utilization of time. Like, for example, as a permanency worker, could their one whole day be going out and traveling and visiting their families? And if they're going to go see a parent, pick up that parent's children and take them to them and have a visit while they're there with them, right? And then spend a whole day at home doing their documentation, doing their case notes, writing case plans. So we're just really thinking through strategies about utilizing what we learned, and some things do need to sunset, but a lot of lessons learned about the utilization of our time, value around in-person versus virtual engagement, and how we can use technology to keep children engaged and connected to their parents, even more so than just those in-person visits.
Thanks, team. And this is Rebecca again. So I was remiss. There's one thing I do want to call out that I didn't include when I listed out some of the the investments that have been made into child welfare. Is one that we're actually really excited about is the ability to create and administer a respite program in support of resource families caring for children, and being able to have that as a benefit and a service that is available to families. And so we'll have more information as that evolves and comes to fruition. And in wrap up, I just want to really, acknowledge that, change is hard. Everyone says that. Transformation takes time, and some things aren't going to move really, really fast, because we want to be really strategic and intentional about how do we build forward what it is that we want. And with that, we are committed to finding more, better, new ways to have more and more involvement and input from people who have lived experience. So young people who have experienced our system, parents who have experienced our system, our resource families, our provider partners, our community members at the table with us as we are trying to create what it is that we need to do, make decisions about our path forward, and not do things in a vacuum, which I think, is probably how state agencies oftentimes operate, right? And so we're really trying to build it into all of the places where we're having conversations and thinking about what is it that we need to do, how do we need to do it, where and who needs to do it. And so look for opportunities to be at the table with us. We are going to do these sort of chats and community engagement as much as we can. And so we have a few dates scheduled out for the remainder of the calendar year. They will likely be virtual. We're going to be exploring how do we do hybrid circumstances and be traveling around and being able to engage with folks in person. But we really absolutely appreciate the time that you've given us today. And a thank you in advance for your continued commitment to partner with us as we really bring this transformation to life and collectively work to serve children and families and communities here in Oregon. There's opportunities for you, if you haven't done so already, to sign up to be on our child welfare email list. And it is listed on our website, and it will be in the information that we send out following this discussion. And I just thank you. It is, like I said, been a really incredible, bizarre year, and it has impacted all of us in a variety of different ways. And I think for me, what I am coming out of this with is just a continued and renewed energy and commitment to finding ways to best serve children, families, and communities in a way that is supportive, trauma-informed, has an equity lens where we are stopping some of the historical systemic things that have been in place and really working to build our collective well-being system so that we're serving children and families at the time of crisis and challenge long before maltreatment occurs, and that we are really building our partnerships with those who have been our partners for a long time and finding those that haven't been and finding ways to have folks at the table with us. So thank you to my team for being able to respond to the questions that came in. And thank you to all of you for your partnership with us and the continued work that we have moving forward. And we just wish you well. Thank you.